my name is Cassie Kleppel. Today is October 26th and I'm doing my insulin videos. So before going into the patient's room, I would do all my 5 medication checks. I'd make sure I have an order for insulin. I would check their blood sugar to make sure I know how much insulin to give. So we're gonna do the pen and we're going to be mixing 2 insulins. So for the pen, I am going to roll and clean off the top. And apply my needle. I'm going to waste 2 units. And then my order is for 5 units, so I'm going to draw up 5 clicks. And then I'm going to recap until I'm in my patient's room. So when mixing, I'll get my syringe. For the order is pull up 4 units of regular and then 8 units of NPH. So first I'm going to clean off both vials. And then I'm going to roll my NPH. So I'm going to pour back 4 units for my regular insulin. Make sure there's no air bubbles. I'm going to pull back 8 units for my NPH. And then I would recap until I'm in the patient's room. I would also check with another nurse to verify the correct amount of insulin to give to my patient. Once I am in my patient's room, I will get their name and date of birth. And then I'm also going to make sure I rotate sites for my different insulins and inject it into the subcutaneous tissue. So for the pen, I'm going to inject in the left arm in the back in the fatty tissue and clean it with the alcohol. I'd wait for it to dry. Remove my needle cap. Tell the patient on 3 I would poke, so 90-degree angle. And I would inject. I would make sure to hold it in place for at least 10 seconds, that way the medicine is getting into the tissue. After 10 seconds, I would remove, recap, and then throw my needle into the sharps. So I'm gonna put this into the right arm, fat tissue. Once it dries, go in at a 90-degree angle again. 1, 2, 3. And then inject, and this time I don't have to hold it into place. And then I recap and throw my sharps into the sharps, and then I would document how much insulin I gave, where I gave it, and how the patient tolerated.